Good morning. Praise the Lord. Uh, I slept a little bit, tossed and turned a lot, but I heard the birds chirping and praising the Lord, and I said my prayers too, and we back up again. And as I was in the process of my morning routine, I thought to myself, I talk about my neurologist a lot, Dr. Potts, and he is awesome. So I thought that this morning I would give you a little bit of background about him. And we are coming from you from the living room today, so I'm not in the bed. Um, but we are coming to you from the living room, and we're gonna tell you a little bit about Dr. Potts. Uh, Let me get a picture for you. Let me turn this around, and that is what he looks like. And I'm gonna read to you a little bit about him. Um, let's see. Dr. Daniel C. Potts, MD, FAAN, whatever that means. So there's some sort of neurologist, I don't know. But it's FAAN, is a neurologist, author, educator, and champion of those living with Alzheimer's disease and other dementias and their care partners. Selected by the American Academy of Neurologists in 2008, Donald M. in 2008 as the Donald M. Patalucci Advocate of the Year. He has been designated an architect for change by Maria Shriver in 2016, and he was chosen by the University of Alabama Medical Alumni Association as the recipient of the Martha Myers Role Model Award, honoring physician alumni whose lives epitomize the ideal of service to their communities, inspired by his father's transformation from a sawmiller watercolor artist in the throes of dementia. Through person-centered care and expressive arts, Dr. Potts seeks to make these therapies more widely available through his foundation, Cognitive Dynamics. Additionally, he is passionate about promoting self-preservation and dignity for all persons with cognitive impairment. He also lives with his wife and two daughters in Tuscaloosa, Alabama. So, that's quite an impressive resume, and that's just the beginning. He has written, let's see, he has written 6 books. One, two, yeah, 6 books. And I think he told me that he was working on another one, but he has such a hectic schedule where he doesn't really get time to do it. And I understand that because, I'm an author too. And well, I used to be. I don't write as much as I do. I used to. But I understand that it's hard to make time to write because you have to sit down and get all your thoughts together, put them on paper, type it up, and review it. May change your words around. So it's there's a process to it, and it's time consuming. So I understand when he says that he doesn't have. That was getting kind of bright. The time that he wants to put into it like he wants to. Um, and the other thing is, I have an appointment coming up with him here in a few days. I'm thinking about like is it next week? It's either next week or week after next one. That I'm just gonna ask him about what are the neurosurgery options for my migraines. Because at the pace that I'm on, I can't keep this up. This is not like a long-term solution, just me taking medications, having migraines 2, 3 times a week. And this is not a viable option. Whenever the humidity drops or one of my other triggers hit and, my head hurt and I'm laid up in the bed, this is not a viable option. So we going to have to try something else. I'm already on so much medication that'll choke a horse, much less me. Um, so we're going to have to try to find something um, to try something, a different option. And, the thing about Dr. Potts is he's cool with that because every time that I go see him, he will put out his suggestions, what he thinks, and then he would ask me how I feel about it and what I think and what I want to do as far as what I think would work best for me. And that's the thing I like about him because he really sits there and listens. He don't, because once you get back there to his office, he has like a little makeshift office, and you would think for somebody his stature, his office will be a lot bigger. You would think that, but it's not. It's like a little makeshift office. It ain't all that big, and he is more interested in what you think. I mean, he will give you his professional opinion, but he really wants to know what you think, how you feel about it, what options do you like or what options do you don't like, because he is just, to use his words, he is just a purveyor of information, you know, and he will sit there and listen to you. He is not going to rush you out of his office, because you know how like you'll go to like the doctor and they triage you and take you back, and you sit back there in the office for like 20 minutes, 30 minutes, and they come in for like 5. And that's not Dr. Potts or his staff either, for that matter. Let me get shout out for them too. Like Pat, she's awesome, but and the rest of his staff, Pat's his nurse. Um, uh, they're not gonna rush you. He has other people to see, and he do stay on schedule for seeing each of his patients. But if you schedule for 30 minutes to see him, or if you schedule for an hour to see him, he wants to use that whole hour, that whole 30 minutes, whatever time frame it is, depending on what your appointment is, and he wants to talk to you for that amount of time. He wants to see what's going on with you for that amount of time. He is not going to rush you at all. Speaking of which, I have several other good doctors and clinicians that do the same thing, and like I said, I was really blessed. Like Miss Wilder, she's my mental health nurse. She listens as well, and Mr. Wade, he listens as well too. He's my mental health social worker. Um, he's more like a therapist, but he listens as well. And but just between those three, I am in a lot better place than what I used to be. And my primary care doctor, Dr. Grubbs, he's okay. I like my old doctor, Dr. McKnight, better, but Dr. Grubbs is all right. Um, but I have been blessed with some good people, and if you want your care to be better, especially when it comes to chronic migraines or whatever you're going through, like I said before, you have to be a student of your health. I get brain fog sometimes, so that's a part of the chronic migraine. So that's why I have to like stop all the time. But um, you have to be a student of your health, and part of that is getting good doctors, nurses, your whole treatment team around you so that they can help you make the best decision. Because keep in mind, at the end of the day, you got to go home with you. It's your life. But you need them to help you make those good decisions. You know, the exercise and the drinking water. And I know I'll be the first one to say, when my migraines are going on, I can't even go outdoors. But because everything hurt outside. But, like I said before, there's things that I can do inside, to try to exercise, drinking water and stuff like that. And that was a suggestion from Dr. Potts. And it helps. I can't go outside like I want to, especially now because they're going to cut grass. They're going to cut grass again today. But they're going to be away on the other side of the park. It ain't going to be over here by me, so I should be okay. But you need those people in your life to help you make good decisions, sound decisions that will benefit you. And I know, especially like with chronic migraines, we need all the help we can get because, to be bedridden like 8 migraine days out of a month, not to mention the post-stroke, and not to mention like the other times when you just have like a regular headache. That's a lot of time. That is a lot of time where you are not able to do much of anything, if at all. And you need to have those people in life to help you make those decisions about medications, about, like I said, I was going to ask him about neurosurgery and see what he feels about that. And maybe he can give me some and that's the other thing about Dr. Potts. He just don't tell you about stuff. He'll let you read it for yourself because he will give you the literature to read up on it for yourself. He will give you he'll give you the website if you don't already have stuff in his office where he'll just give it to you. And it's not like pamphlets or anything. Like, it's like he went on the internet or went in his medical journals, found that information, printed it out, and said, here you go. And then he'll sit there and he'll go over that literature with you, line by line. He is like awesome. And then to that degree, Mr. Wade will do that too. He will give you, because he gives me like all kind of information about my mental health issues. That's another reason why I can talk about them now like I couldn't before. So that's all a part of having good people around you. Especially like, because there are going to be a lot of days when you are depressed. And the folks who suffer from chronic migraines know what I'm talking about. Or if you're suffering from any chronic illness for that matter, you know what I'm talking about. You'll be depressed. A lot of times it feels like life is going on without you. A lot of times you feel like, at least I'm saying that at least with me anyway, that's how I be feeling. People will come and go, and like holidays will come and go. And I mean, it's hard for you to celebrate, just say Father's Day, because Father's Day is coming up Sunday. It'll be hard for me to celebrate Father's Day, and I'm in the bed with a migraine. Or Christmas or Thanksgiving. It's hard to do get-togethers when you laid up with a migraine, or you have some other chronic illness that keeps you in bed. See, that's hard and that's depressing. See, that wear on folks. And a lot of times folks don't really understand that. And not just you, but then your caregivers too. Because, see, they see you going through all this stuff, and there's not a whole lot that they can do to help you. Because I remember when my mother, not my mother, but my grandmother had Alzheimer's and dementia, and we saw her going down piece by piece, but that wasn't a whole lot we can do. And me and my mom was the primary caregiver for her, you know? And it's just like you lose a piece of them a bit by bit, you know? And now the same thing is happening to me, you know? Because having all these chronic migraines and stuff, I know that's affecting my brain, like for real. You know, and I don't want to be like the guy that's just like sitting in a corner with a wrinkled shirt on and drooling. But I mean, I don't mean to be sound flip about it or crass about it, but then I think to myself that, that may be a real possibility for me, you know? So I have to surround myself with people who can help me not be that guy, you know? And that's no insult to people who may be in that situation. I'm not trying to dish you or talk about you or be disrespectful or anything like that. I'm just saying that chronic illnesses wear on you. They break you down. And the one thing that you can do to help yourself is to surround yourself with good people, with good doctors like Dr. Potts, Mr. Wade, Ms. Wilder. Surround yourself. And it may take some doing. It may take some looking. It may take some waiting. Because, when you're good at what you do, people want to come flock to you. So it may take a while, and just be patient, but you'll get there. It'll be fine. As far as having like doctors, but I'm a big advocate for prayer too. So don't forget to pray to the ultimate doctor. You know what I mean? But while you do that, he'll lead you to the doctors that you need to see. Anyway, like I said, this is my morning. I got a good 4 hours of sleep. So I'm going to put that good 4 hours to use and start my morning routine. Like I said, I'm here in the living room. Look, see, there's my Last Supper picture right there. I am so proud of that. I really am. I like looking at that. But y'all take care and take care of each other. Take care of yourself. All right? Love you. Oh, and by the way, a big shout out to Kimi Kuniyoshi for liking this channel. Peace. I love you. Go Navy.